And next we have David.
Thank you. Well, I interpreted this seminar to be about the happiness industry rather than happiness per se. So I think I'll be broad, agree with you with that. Because I think that the kind of happiness sold by the happiness industry isn't really, yes, more or less. It, not only is it crap, it probably runs counter to the goal of a better society. But, I mean, to begin, speak up. Why would anybody object to happiness? Many in the side disciplines, by which I mean psychiatrists, psychotherapists, certain social workers and other mental health workers, and above all psychologists, purport to hold scientific knowledge about happiness. Why should anybody try to prevent them from implementing their knowledge? That's the question I'd like to answer here today, beginning with a sketch of how mental health policy came to its terminus. Now, psychoanalysis may not have been the original talking cure, but it was the most famous for much of the 20th century. Its origins were in turn-of-the-century Europe, where the fault lines between individual desire and the rule of family and community were increasingly apparent. Its operating principle was that of transference, namely a long-term relationship between patient and doctor, in which the former was permitted to say anything whatsoever, and even nothing at all. In contrast with the practices that developed across the Atlantic in the post-war period, it had little to do with the pursuit of happiness, and, developed largely by Jewish outsiders in Central Europe, tended not to uphold conformist ideals. Its aim, according to its founder, Sigmund Freud, was to transform neurotic misery into common unhappiness, and it was preceded by a 19th century in which happiness had been roundly critiqued by Schopenhauer, for instance, who regarded it as a pure negative, the absence of suffering, and by Nietzsche as well, for whom happiness was something rather bovine. European novelists and poets had emphasized the dark and divided nature of subjectivity, from Baudelaire's self-torturing man to Dostoevsky's double. Contrary to popular belief, treatment was possible for low-income earners in this method, though it needed subsidy, in essence, from those of greater wealth. Darkness and division were not confined just to the pages of literature, however, and the cataclysm that ensued across Central Europe created a diaspora of talking therapists across the nations. In particular, there was mass demand for treatment in the US after World War II, ranging from the fairly brutal, such as lobotomy or disabling neuroleptic drugs, to various forms of talking therapy. Shorn of its continental European underpinnings, talking therapy became less philosophical but more evidence-based. Long-term talking treatments were still possible, sometimes for the poor, but the emphasis shifted from uncovering unconscious divisions and desires to bolstering ego strength and modelling the patient's ego on that of the doctor. Psychoanalysis still existed, but in the US at least, it was a very different discipline to that practiced in Van der Zierk, Vienna, and was accompanied by pharmaceuticals and cognitive and behavioural treatments. Now, from around the 1980s, the era of Reagan, of Thatcher, I think we can call it the era of neoliberalism for short, mental health began to take on a somewhat different look. Psychiatric drugs became more refined and their use greatly expanded. It was during this period that drug companies became some of the biggest on the US stock exchange. Long-term transferential models of treatment were replaced by directive, coercive, standardized treatments, assessed by the most reductive quantitative means, which now resembled KPIs, and encouraged the sort of short-term thinking that emerged in the corporate world with quarterly reporting, for instance. The doctor was less a guide for a patient in misery than a kind of tailorist of the soul, who monitored the patient in rational thinking and speaking, assigned homework exercises, and instituted various methods of surveillance and discipline with the aim of having the patient internalize this into self-regulation. This was and remains what is now called scientific psychotherapy or evidence-based treatment, and in this era it emphasizes cost-effectiveness and soft policing above all else. The pseudo-scientific status of all this within academia and policy precludes most analysis of its ethical and political dimensions. So in Australia, for instance, a militant exponent of 1990s economic rationalism, namely Jeff Kennett, can be head of a mental health advocacy group, whilst a director of Transfield, a company which takes taxpayers' money in exchange for a rebranded version of torture, is a director of another mental health group, the Black Dog Institute of Sydney. To be clear, mental health is not a unified field, and what I describe here are broad brushstrokes, which omit many important exceptions. Moreover, whilst the medical profession is partly the author of the side disciplines, the present models are not entirely medical. To the extent that there is a medical paradigm in operation, it follows a pattern of expansion and refinement of discipline that has been ongoing for at least the past century. For instance, the latest DSM, this is the psychiatric manual listing all official diagnoses, has now expanded to the extent that about 60 to 80% of all Australians would qualify as having a mental health condition. Nonetheless, the medical model also sets limits to intervention insofar as it is preoccupied mainly with the abolition of symptoms. In times of scarcity in public health, economics can come to warp the nature of medical assessments. In my city, Melbourne, the public hospitals exhibit a mania for preventing so-called secondary gain, and so suicidal patients are routinely refused treatment on the basis of their personality, on the unproven assumption that intervention would worsen their symptoms by giving the person the attention they're allegedly seeking, for instance. So we can see political economy can reorganise the science of diagnosis and assessment itself. The new paradigm of the neoliberal era, however, is not merely about conquering illness, but of enhancing normality even when no pathology is present. This is a fundamental shift, however slight. By definition, and in contrast to medicine, enhancement has no limits to its domain. Again, there is the pattern of refinement and expansion, as evidenced in the growing positive psychology movement, or in the use of neuroenhancement, as well as a growth in intervention at an institutional level. Mindfulness can now be found not just as a technique in the mental health clinic, but in the hospital, the prison, the workplace, and the school. Positivity has become an urgent moral imperative, a commandment of the superego, to use the old language, and one whose counterpart is not, incidentally, an epidemic of depression and anxiety. In all of this, I don't wish to promote some nostalgia for other times and places, and still less do I intend to dichotomise a good continental psychology against a neoliberal Anglophone one. What should be emphasised is that the metamorphosis of mental health, in line with developments in political economy, is accompanied by changes in the kind of subject presumed by such paradigms. Patients have now become clients or service users, but in effect, the real clients of mental health, in a material sense, are predominantly health insurers and governments, since they are, after all, the ones who foot the bill. For clients as individual patients, most forms of talking therapy can be useful if the therapeutic relationship is strong, according to the evidence, but this finding, supported by extensive research, is almost never what is meant by evidence-based treatment in mental health. The latter always refers to that which works for the health insurers and policymakers, not the patients. And it is the insurers and policymakers who are the actual clients. The patient, with his or her suffering, is an object in every sense. Thus, cognitive behavioural treatments and self-administered online therapy are widely promoted, despite evidence of their effects being trivial, and of these trivial effects being short-lived in any case. Never mind that this call centre psychology is actually shown to work best when its practitioners abandon their treatment protocols. What matters is that they are cost-effective, directive and standardised. They are poor for people, but excellent for governments. The Anglophone world has three waves of evidence-based psychology, the first being behaviourism, whose mission, according to its founders, was to predict and control. The second wave is cognitivism, and the third is a spiritual synthesis of the two, as exemplified by positive psychology. This conceptualization ought to be taken with a pinch of salt. But in any case, what's emphasized across the latter two waves are the supposed strong links between positivity and rationality, the proper use of reason. Again, the evidence here is dubious. Aristotle observed that melancholics, for example, are far from lacking in wisdom, and the empirical results tend to support him. Depressives, for instance, can be perfectly rational when compared to their non-depressive counterparts who utilize adaptive self-deception. As a side note, we should note that in mental health, whenever anybody uses the term, or whenever we hear the term adaptation, we should be aware that we're listening to an authoritarian. If the 20th century demonstrated anything, it's that many forms of reason are perfectly compatible with enjoyment in destruction, including enjoyment in self-destruction. The contemporary evidence base is innocent of such reflections. Moreover, if we take cases of inattention, sadness, anxiety, anger, and so forth to be a byproduct of biochemical malfunction, or alternatively, the poor exercise of self-mastery and reason, it allows for these symptoms to be localized in individuals in a context-free way. The symptoms can then be manipulated or suppressed with techniques without any regard for their meaning. The techniques themselves amount to a grab bag of positive or rational thinking, the two now being conflated, general health tips, drugs, and exercises in distraction. In these paradigms, the person who suffers panic attacks in the context of workplace bullying, say, is the one who requires fixing, rather than the pathogenic context itself. When LDP Senator David Lionhouse recently quipped that offence was purely a consequence of the bad reasoning of the offended, that one bad feeling could surely be substituted for another better one, he wasn't just parroting self-serving libertarian defences of bigotry, but he was echoing mainstream psychology. It is in this milieu that we find the merchants of happiness with their doctrine of mindfulness, authenticity, and critical positivity ratios. A critical positivity ratio, by the way, is a precise ratio of positive to negative thoughts supposed to produce flourishing. For those who are interested, the number is 2.901. The previous waves of evidence-based talk therapy were explicitly corrective in their function, attributing suffering essentially to the pain subject's own mislearning or distorted thinking. The latest wave is less an overt re-education process and instead emphasises pacification and resignation. To the aforementioned techniques of the older waves are added procedures of gentle acquiescence, from a meditative focus on the present to the use of colouring books. All this is framed in a jargon of authenticity and glossy reminders that the practices in question are spiritual. With some exceptions, the aim isn't so much the pursuit of happiness as the pathologizing and erasure of negativity. It's resolutely anti-intellectual, and those who take up this way of treatment are explicitly encouraged not to think too much. The accent in this doctrine is placed on a supposed pure present, which tends to make its proponents anti-historicist. A creed that peddles the forgetting of history and opposes critical thought is, in my view, inevitably on the side of the oppressors rather than the oppressed. Still, some might wonder whether it's such a bad thing after all for clinicians, teachers, human resource departments and others to bring some tranquility to the minds of their subjects. The treatment in question may look a bit like an attempt to induce mild senility, to be sure, but what harm can there be in colouring books? Well, whenever governments, militaries and corporate entities attempt to implement mental health protocols on a massive scale, I think it's worth asking a few questions about the motives involved, and I'll ask some of these questions shortly. The key to the side disciplines is that their practitioners willingly, if unconsciously, serve as the handmaidens to power, and this is why, for example, in the US, psychologists were permitted for years and with the authority of their institutions to practice torture on inmates at Guantanamo Bay. What does the call to authenticity mean here? We should recall the concept of narcissism, I think. Nowadays, this term tends to be used in a moralistic sense to denote somebody's selfishness or egoism. But its original Freudian meaning referred to a person's relation to their own image, to their own body. In this sense, authenticity, the imperative to be true to yourself, is in fact a demand for more narcissism. The literature on the topic makes this quite clear, that the authenticity at stake in mindfulness, say, is a matter of a unified subject expressing themselves in a kind of perfect self-identity, being true to themselves, and it isn't much concerned with authenticity regarding other people. I mentioned the 19th century earlier, and that was a century in which Paul Rambaud, for instance, could assert that I is another. The I nowadays in psychology is a much diminished figure who only needs enjoyment, here and there. This model presupposes human beings who are isolated monads, who consume and who are encouraged to consume, but who do not relate. The contemporary cult of self-esteem belongs as an adjunct to this practice, since to stand before real or metaphorical mirrors scrutinizing oneself is always an exercise in narcissism, irrespective of whether one's judgments involve self-praise or self-blame. What kinds of happiness or positivity are at stake in this approach? It appears to be something rather tepid. The evidence-based treatment protocols promote a pleasant activity schedule, the activities of which tend to be in line with pacification. Things like flower arrangement, for instance, and rather than Dionysian revelry. Though curiously, on one such protocol, I saw share trading listed as a pleasant activity. It's the only form of gambling there. More telling, however, is the approach this paradigm takes to suffering. Outside of strictly circumscribed situations, such as mourning, suffering is subtly but systematically pathologized. It is viewed neither as part of the human condition nor as an indicator of dissatisfaction in one's life, but once again as a personal malfunction to be managed where it cannot be corrected. What kind of spirituality is at play here? Its proponents frequently name-check the Buddha, but the practice is more tourism than Buddhism. One aspect of Buddhist teaching has been isolated, given a translation, and reduced to a standardized technique to be used by experts en masse in the governing of others. In short, it's about as spiritual as handing out unconsecrated communion wafers at a corporate team building day. What's the aim of this practice? It tends to espouse several, but one that frequently refers is that of well-being. In fact, this word is so ubiquitous now as to be virtually invisible. It's worth recalling that in psychoanalysis, for instance, there is a contrary concept which suffers somewhat in translation, but which can be termed well-saying. This distinction is important since the new wave of psychology focuses on being at the expense of saying and doing. It gives primacy to a narrow ontology over the concerns of ethics and politics and history. It's no coincidence that the political implications of this are universally regressive. The new wave's claims to scientificity only reinforce the problem, since, in masquerading as a science, the new wavers can downplay history and context. Yet recognized sciences can generalize their results under a given set of conditions, as in the case of chemistry or physics. No such generalization is ever possible in mental health. There's been a recent furor in psychology about the inability of researchers to have their findings replicated. This is an epistemological feature, not a bug, since the science in question is by definition a study of irreplicable results. The Schonke epistemology here is not just incidental, since it's also linked to equally dubious political and ethical practices. There are numerous examples, but as I finish up here, I'll mention a couple of prominent ones. In the UK, and it's slowly spreading here in Australia, welfare benefits for the unemployed are now linked to mandatory attendance and positive psychology courses, with the aim of making subjects more marketable for prospective employers. It's not enough for the unemployed to undergo a series of bureaucratic rituals to gain access to money, but now they must also be positive about it. In the US, the guru of the positive psychology movement, a man named Martin Seligman, who came to fame as a behaviorist psychologist who did some experiments torturing dogs, has led the largest psychological intervention in human history. Over 1 million US soldiers have received mandatory positivity and emotional resiliency training using the techniques and doctrines that I've described. Its aim is explicitly one of obedience. The program teaches soldiers to focus on expressing appreciation and correcting negative views of ambiguous events. When soldiers receive onerous or even unethical orders, they are asked to reframe them. See the bright side. Again, we should be clear as to whom the client is here, and Seligman himself tells us when he says that his program is designed to give the US an indomitable army. Short-term thinking is now an established element of governmental thinking and policy making, as well as the corporate world. It is now also an entrenched part of publicly funded services, since the demand for attractive data and KPIs is generally attached to future funding arrangements. Whatever the supposedly scientific claims of psychology and related disciplines, it isn't separate from its culture. And when the culture, through Coca-Cola for instance, exhorts its consumers to enjoy, I think we should pay attention when the psychologists do likewise. Thank you.